afternoon. I'm just going to share my screen. Amir, if you just wouldn't mind just giving me a thumbs up, you can see my screen okay? Just want to double check.
You are good.
Excellent. Thank you so much again. And welcome to this session on the essential 10-step guide to building and communicating your CIO strategy for a post-COVID-19 or post-pandemic world. Really wanted to spend a little bit of time speaking about InfoTech. I know I had some colleagues present yesterday, but just as a refresher about InfoTech Research Group, we provide unbiased, relevant research to help our IT leaders make strategic, timely, and well-informed decisions. And we do that through a number of different mechanisms. You can see on the left-hand side of the screen, we have that fancy colorful periodic table that is based off of the COVID framework. And that's really used to help our members drive measurable results. We employ a number of experts from a variety of different fields and domains within IT, including former CIOs, CISOs, PMOs, management consultants, and academic statisticians and researchers. And we provide that research team to our membership. And so that helps you to dramatically outperform your peers. We've worked with over 30,000 members in our 20 years of existence. And we have employees across the continental United States, as well as in Canada, Australia as well. And so that's just a brief intro about InfoTech. As it relates to our conversation this afternoon about the pandemic, and certainly I know there's been a lot of talk about just the dramatic changes that have occurred in health IT specifically as a result of the pandemic. Our point of view really is shared through sort of a situation, complication, solution framework. And, healthcare delivery environments throughout the pandemic have been challenged. There's been a lot of emphasis on acute care, but certainly our non-acute care providers as well have faced a lot of challenges. The map you see on the screen below that's shaded in is from an open sourced COVID care map, and it measures open ICU bed capacity at acute care centers. And so you can see that was taken just yesterday. So there's still a lot of pressure and constraint on the healthcare system. And, IT's traditional role has been focused on keeping the lights on with a minimal influence around strategic decision making, but COVID really put health IT in particular at the forefront. And technology solutions were used across the continuum of care to ensure that people could still receive healthcare. Hospital IT leaders, especially those in those acute care environments, whether they're in a rural context or if they're in an urban context or a part of a large acute care center or spread across the nation, they can't exist as a utility anymore. And so there's really an emphasis on providing and demonstrating partnership with administrative partners, practitioners, and patients to improve quality of care and really to get through the pandemic. One area then themes that I have observed throughout the pandemic, and this is sort of just still in the setup phase of the presentation, is that there's been sort of 4 themes or challenges that I've observed in meeting with a variety of CIOs and healthcare leaders. So the first area is really around complex collaborations. Even before the pandemic started, there was an emphasis in healthcare around creating a truly interoperable system. And as many of you know, that is extremely complicated. Not only from a technology standpoint, but just from an information sharing standpoint and a data governance and standards standpoint. And so there has been a lot of progress made to achieve some true interoperability, but there's still a long road to go ahead. And there still is that emphasis on achieving interoperability to improve patient experience and health outcome. Similarly, new ways of providing healthcare have emerged. So before COVID, there was a lack of emphasis or, virtual health, remote patient monitoring, telehealth, telemedicine were just sort of on the fringes and weren't really widely adopted. And certainly that changed as a result of the pandemic. Virtual care accelerated the physical visit to a doctor's office in some cases is no longer needed, and it can be mediated through a computer or an iPad or some digital technology. And so that's really useful for especially non-acute visits. So non-invasive visits where you're either checking up on a prescription or you're just checking in with a physician. And it's been enabled through a lot of our peers offering exceptional health IT, and that's really made a difference throughout the pandemic. Similarly, resourcing and available funding. Early on, there was a lot of concern, and in some cases, there still can be concern from institutions around reimbursement. And it ties into that virtual care conversation because virtual visits weren't being reimbursed at the same level as regular in-person visits. There's been waves of stimulus funding through the CARES Act and the American Rescue Plan that have filled in some of the gaps, but resourcing again is still a challenge, and meeting those resource challenges is going to be something that will continue on, I believe, in this sector as we move forward. And then as well, compliance and technology. So the number of hacks, the number of breaches has only increased throughout the pandemic, and healthcare organizations are accountable for greater regulatory scrutiny. And so preventing privacy breaches are really of utmost importance for all of you and for your peers. And so that's why I really encourage an emphasis on maintaining and improving your security architecture. Early in the pandemic, we did offer sort of this essential 10-step guide as a mechanism to reach out to our clients that were, in panic mode because of the severity of the pandemic or the perceived severity of the pandemic. And certainly that came into fruition in a variety of waves. And so we were advising our CIOs that they had a unique opportunity to impact their organization, and many did. Many came through in measurable ways to enable virtual care, to really preserve the continuity of care in many cases, and to set up things like vaccination clinics and to enable the rollout of the vaccine. And so, in true management consulting style, we presented it in a phased linear approach, but that really hasn't been the experience of many organizations. Is that there's been sort of that initial mitigate risk, reduce exposure, send your employees home phase, which some are still in that phase, but adapting within it. And then the second phase around recalibrating and pivoting some of our critical operations. And screening, for example, is one way that we've recalibrated some of our organizations. And so some visitors are allowed to come back into acute care environments. So those doors were reopened and they were closed temporarily. And then the third phase really was about identifying new pathways and new workflows to offering care. So rethinking some of the workflows of the past. And there's been a lot of talk around the new normal and return to the workplace. But again, this is the idealized state. And one of the things that I say to a lot of my clients is that we're working from a perspective of going from ideal to real. And so the reality is that there's been waves of movement throughout the pandemic, and that it hasn't been a straight line, and that there's been openings and then shutdowns and openings and shutdowns, and it's created a lot of disruption. But the point I want to emphasize here is that, again, healthcare IT has been exceptional along the way, and that folks on this call have really done a great job of preserving, again, that continuity of care. And so hopefully as we move into that phase 3 of sort of the new normal, we can learn a few new things and adjust the way we deliver care, and maybe enable more technology to be involved in that care delivery. So that's where I revisited our 10-step, I say pre and post pandemic, because we did offer 10 steps for our members, pre-pandemic, and now hopefully we're moving into that post phase. And so this is where I want to spend a bit of time this afternoon talking through some of these ideas and some of these 10 steps. So the first area is around aligning IT strategy with your organizational strategy. So I'll speak on that point quite a bit. Certainly we want to inspire our teams and, if possible, over deliver and really set stretch goals so that we can provide great service to our patients and providers. We want to leverage technology in new and exciting ways if possible, and relook at our technology stacks to become more excited about the opportunities that exist there. Focus again on customer service and meeting our practitioners and our providers and enabling them to do the critical work that they've been doing all along. And as well, leveraging and transforming existing data sets and reevaluating those data sets from a governance perspective to get the most out of the data that we are collecting within our systems. Improve processes and identify opportunities to innovate. Reprioritize and cleanse some of the project backlog and revisit those roadmaps that may be on the shelf. And since this conference is really focused on security and privacy, constantly and consistently review and revise security and compliance priorities. Finally, identify and pursue new sources of funding, whether it's through the ARP funding, through other mechanisms for state and local funding, to identify those areas and pursue them. And then finally, to take advantage of the templates and learnings from other peers on offer. And so this mechanism, this forum today is a great opportunity to do that as well. IT success really is dependent on demonstrating a deep understanding of organizational priorities. And so when I was speaking about the first point around developing an IT strategy that's robust, traditionally IT has been set apart and separated and in an isolated support function. And really, that's no longer an option. IT can't continue to work in a vacuum without understanding of the wider organizational strategy. And so foundational to a lot of the advice we provide to our clients is sort of seeing and thinking strategically about what IT does, how they do it, and where they can offer more value to their key stakeholders. And so when I advise some of my clients, one of the things is I borrow from the AHRQ framework of the 5 rights. So developing a culture that's collaborative is very critical, and an information culture in particular that emphasizes the right information to the right person in the right format through the right channel at the right time. And so there's a lot packed into those statements, but as a foundational approach within IT, I think it's the right way to go. Healthcare organizations have to be seen as a value generator, not just a cost center. IT really must help practitioners and patients achieve their goals within the system. And so we help our clients and our members establish a clear link between health IT strategy that identifies the overarching goals of an organization, but then links back those goals to specific IT initiatives, projects, and functions. And it's really in an effort to establish a shared understanding of what each stakeholder does and elevate the perception of IT. So again, CIOs must think about what they have to do day to day to meet their future needs. And, it goes anywhere from, should I use a hybrid cloud model or do I outsource? There's a variety of different areas that we advise clients on to improve their standing within an organization. One area that we advise a lot of members on is we work on benchmarking. And so we send out diagnostic surveys to our membership that surveys their peers, the users of IT, so the people that they serve. And we plot where an IT team is functioning on a maturity ladder. So that's the colorful stack you see on the right-hand side of the screen. And this really helps us have an informed discussion after we look at the results of these diagnostic surveys to establish where the team is working at presently and where they would like to be at once the strategy is completed. And so that helps us establish a current state for the team and a target state. And so you can see the colorful bars indicate different levels of the maturity. So it ranges from unable to support and struggle to support all the way up to innovation and transformation. There's levels in between related to creating business partnerships and expanding. Trusted operator is the yellow phase of increasing efficiency and decreasing costs. And then firefighter is keeping the business happy, cost low, but there's not anything transformational happening there. And so again, we use these benchmarks to have a discussion about where they are today and where they'd like to be. And so this is an example of some of the assessments that we would speak about with our membership. So in this example, the team target is business partner or innovator. And some of the goals that they're going to establish to achieve that include an emphasis on innovation, value, and performance. So again, under the value statement, IT will undertake strategic initiatives that support objectives. This is just sample language. So of course, when we meet with you one-on-one or when we engage together, we would be much more prescriptive and directive on what value means to your organization. But it really is in an effort to give some stretch goals and to set some target states that match the capacity that your organization can handle. Another tool or template that we like to emphasize with our clients is to map out the strategic direction of an organization. And so we do that through a variety of business stakeholder interviews, or if they have a pre-existing strategic plan, we look at their strategic plan and write that down. So what you see on the left-hand side in those gray boxes are an example of a strategic direction, and then some organizational context. So resource availability and responsiveness, customer experience, leveraging and expanding expertise. And so those components are then matched to IT objectives and IT goals. And so in the engagement, what we would do is sit down together and map out specific IT objectives and IT goals. And that creates a complete link to the organizational context. And it helps us to communicate to our business stakeholders how IT is directly supporting the strategic direction of the organization. Another tool that we like to use with members is this idea of a reference architecture. And so to uncover specific value streams, so the highest level outcomes of an organization. And so we do that through, again, establishing context by reflecting on our relationship with care providers and practitioners, with product producers or product owners, payers, and patients, and then come up with specific high-level values or outcomes that an organization is meant to achieve, and then map specific capabilities that contribute to the overall value of an organization. And so this is what we call a reference architecture, and it really is used to identify high-impact, critical need capabilities that can be supported through IT. And so here again is an example of a map that we use with our members to tactically have discussions about capabilities. So this would change, again, the high level outcomes and the associated capabilities may change depending on which part or which sector of healthcare you're representing or serving. But the idea as well is that we can heat map the capabilities to identify cost efficiency creators and patient experience differentiators. And we also can uncover defining, shared, and enabling capabilities. So which capabilities are unique to your organization, and define how you provide this higher level value to your patients and providers. Which capabilities are shared so they can move across these higher level value streams and are end user facing, but have some differentiation in the way that they are perceived within an organization. And then from an enabling perspective, which capabilities support the creation of strategic plans and may operate as a shared service to enable all of these defining and shared capabilities. And so this is, again, a really great way to understand what an organization does in a snapshot and to provide some context, not only for your IT team, but for your other business or organizational stakeholders. Another outcome of this exercise is to really focus on the core health delivery functions. So which areas need to be prioritized? And so we do that through a quadrant, and we look at sort of the value to difficulty matrix and plot different capabilities within the quadrant. So whether they should be prioritized, selectively engaged with, deprioritized, or outsourced. And so in this map here, what you see is that communication management and admission management is something that is of high value and low difficulty, and therefore can be prioritized. Another area that we advise a lot of our members on is how to manage their project backlog. And so this, again, was of extreme importance early in the pandemic, and I'm sure a lot of teams are revisiting their project backlogs and evaluating what makes sense for them. And so in the tiles you see on the right-hand side, they are different examples of tools that are created within Excel that help manage the IT backlog. And so the purpose of this is to identify items that should be started, identify items that need to be revised or refreshed, and those that can be removed because they're either irrelevant, outdated, or of low value. And so the message here is that you really want to work with your governance committee members and leadership to have a solid format for decision making and communication among the key stakeholders within your organization. And it's also key to remember that there are no industry best practices around backlog management. It's really just that you are setting your own individualized targets based upon what's right for your organization and your portfolio. And that it's something that all members of the leadership team are comfortable with. Another area that we advise members on is to look at, a business process assessment and prioritization tool. And so in this example, we're looking at opportunities to prioritize critical processes that could be ready for automation. And automation has come up a number of times for health IT leaders, especially in the area of artificial intelligence and natural language processing. Machine learning has always been on the horizon for healthcare. So this tool, again, is something that we've created for our members to put into specific metrics into an Excel sheet and to identify business priorities. So document basic information about an enterprise captured within the various tabs, and then evaluate those business processes and identify key processes that can be used for automation. And so candidates for automation would fall in the sort of the upper right-hand side of the image that you're seeing. So that sort of sunshine type diagram. So any of those identified would be priority and opportunity from a cost and satisfaction perspective. Another area that received a lot of attention throughout the pandemic, and certainly early on in the pandemic, was evaluating business continuity planning. So early on in the pandemic, there was an emphasis around disaster recovery and business impact analysis. And so we do have a number of tools, again, that help our members prioritize, evaluate, and document the various processes and functions, as well as process owners, and as well as documenting dependencies and people involved in the delivery of various processes, what priorities need to be taken into consideration, who are the primary owners from, for example, an application, data, or service perspective, who are some of our end users, and which facilities are they located in. And so this provides a lot of value to members in terms of organizing a lot of that critical information that comes into play for continuity planning and disaster recovery as well. Data governance in general is just such a hot topic, no matter which industry you're working in. But again, certainly for healthcare, it's something that people see a lot of opportunity in because of the advances of computing and cloud computing, and just relooking at a lot of the stack and infrastructure that IT oversees within healthcare. And so this model here is what we refer to as our data governance model. And it's a critical model because it calls out a lot of important areas of data governance. So on the left-hand side, what you see are sort of this business strategy that we talked about earlier, and then formulating a specific data strategy that has specific strategic goals and objectives identified. And then when we're talking about governance in this colorful sort of donut circle here, what we're seeing are different components that make up data governance. So things like establishing an operating model, defining policies and procedures, encouraging a culture of data literacy, enterprise projects and services that have a severe impact on data governance, your overall stance of data management, data privacy and security, the leadership that underpins your data governance model, and then your stewardship model as well. And so this is sort of a side process here around enterprise governance and oversight and alignment in these two data governance, leadership and stewardship phases. And once this sort of wheel is established, there are certain outcomes that can be achieved. And so one outcome is related to defined accountability and responsibility, knowledge and common understanding of critical assets that exist within your organization, a trust and confidence in traceable data, improve return on investment and reduce technical debt and data debt. And then again, the support of ethical use of data and a data-driven culture. So establishing sort of those ethical use cases, making sure that there's flexibility in your data set. I know there's been a lot of interest lately in developing out sort of social determinants of health within healthcare data to further enable patient care and to sort of see the wider lens of care communities. And so that's an area, again, of supporting ethical use of data within an organization. And all of this is underpinned by, your local laws, federal laws related to HIPAA, but then also local and state laws from a privacy and security perspective. Another area, and again, I think this would be very relevant for a lot of the people on the call this afternoon, is to review and revise your privacy, security, and compliance procedures. So as I mentioned in my intro statement, there's been a lot of pressure on IT related to securing their technology stack and making sure that breaches are prevented. So we have a privacy program that prioritizes sort of understanding your governance and your laws from a federal and state level, but then also mapping out processes and tools of business process that are affected by privacy and security and compliance standards. And then as well, prioritizing those various initiatives within a schematic framework and deriving metrics. And so these are the various components that we advise members on a daily basis. It helps them to identify acceptable risk within their organization. It helps them remain compliant with overarching laws. It obviously helps protect personal health information and understand key data processes that have an impact on privacy and security. And so what we often are advising our members on is to create a framework that is scalable and quantifiable, that everyone has an understanding about governing privacy laws and frameworks, and to create a map. So we have a variety of templates and tools that create maps of personal data and how it flows within an organization. We help our members as well to prioritize various privacy initiatives and build a privacy program timeline, and to select metrics that are functional and relatable for your organization. The overarching, again, emphasis here is to continue to revise your data privacy program because things are constantly changing and there are new threats that are being uncovered on a daily basis. And then one additional element that I like to bring up with members is related to a digital strategy. So I know we spent a lot of time talking about sort of that overarching organizational strategy, but there are also opportunities to look at your specific digital strategy and what different impacts are being felt. And so in this thought model, what we're presenting here is a aspiration to be modernize, support, and business transformation. And so we want to evaluate all of the different outcomes and areas that would be affected by a digital strategy. So from an analytics and BI and data architecture perspective, what does modernizing the platform have, and what impacts would that have on your existing workflows and models? from a security, risk, and privacy perspective, how do we make sure that we can do an updated digital strategy or undertake an updated digital strategy in tandem with ensuring compliance and from a risk and privacy perspective, as well as from an operations perspective. We also want to look at different methods and service experience, so from a customer service perspective and from a service desk perspective, as well as looking at it from an infrastructure lens. So from a network, end user, cloud, what impacts fall all on there. And then finally from enterprise application and customer experience. So this is another thought model that we try to, again, coach our members on, and it would be very involved for certainly acute care network, because of all the different technologies that you're entrusted with maintaining, such as electronic health records, electronic medical records, imaging software, if you're a part of a health information exchange, revenue cycle management, telehealth, and other analytic tools, decision support tools as well. So there's a lot of different technologies at play that are supported by health IT practitioners that really need to be considered from a regulatory framework, but just from an overall landscape perspective. There's a lot going on for health IT. And finally, we do offer specific industry advice to our members. So we do have an industry lens on the research that we're producing, and that's the area that I work in day to day at InfoTech. So I advise members within the healthcare space on strategy alignment, reference architecture, developing out value streams. And so really uncovering those defining shared and enabling capabilities that help your organization excel. And so that's one pillar of 4 that is a part of our industry membership. We also research and identify top trends affecting the healthcare industry. So I mentioned artificial intelligence, machine learning, natural language processing, and other advances from a technology perspective. We did a playbook on virtual healthcare recently to support our members as well. And so this really helps our members stay on top of trends and become aware of what's going on within their industry. Another area that we focus in on is benchmarks. So I mentioned in that colorful maturity ladder slide earlier that we do have a lot of benchmarks that give outputs like that maturity stack, and then we segment them out based off of industry, the industries that we cover, and provide specific reports. So we just released a staffing diagnostic that broke down how health IT teams are staffed within the sector, and where health IT spends a lot of their time from a staffing perspective. We also do that from a what we call our CIO business vision diagnostic. So we look at how the perception of IT functions within an organization, and then zero into just healthcare results. And then finally, we do a lot of technology reviews. So we will undertake custom vendor landscapes, look at specific software that you may be interested in procuring. And we have a whole section of our site devoted to reviewing software as well. And so that really helps our membership make informed decisions about investments in new software, upgrades to existing software. We have a monthly roundtable that our members also engage in. And so that's, again, where you can learn from peers and speak to peers about what's going on within the organization. That helps peers share best practices and network as well. And so we have a whole schedule of roundtables that our industry members attend. Finally, really just talking about different resource centers that we've developed throughout the pandemic. So the initial one was that COVID-19 It's Time to Act resource center, which this initial strategy document came from. And so that was advising members on business continuity planning, disaster recovery, security, et cetera. We still have that as an active resource center on the site, and people can still look at it and download materials from there. But we also have developed American Rescue Plan Research Center. So when a lot of that funding was announced in the spring, we were advising members on which grants were available, giving them tips on developing out a grant strategy, helping them connect again with other peers in their area that were pursuing funding. And so that was something that's something again that's still live on the site that you can access if you're pursuing grants from either your federal or state or local government. And then we also have a Return to the Workplace Research Center. And so this is in tandem with our McLean and Company organization, which is HR focused. And so this is giving our membership advice on safely bringing people back into the workplace from a health and safety perspective, from a screening perspective, making sure that people are compliant with, again, local state laws as needed. And so I don't want to take up all the air in the room, the virtual room today. That was sort of the balance of the presentation that I wanted to share with you. There's a little bio on me that Amir kindly read at the beginning. I also have a link to my LinkedIn and my email, and I'd be happy to speak with any of you kind of after the call, but I just wanted to open it up for questions.
Yeah, actually, thanks, Jennifer. That was fantastic. I love the agnostic viewpoint. One of my favorite parts about InfoTech Research Group is there's no slant either way other than for the CIOs and CISOs that you guys service. There are a few questions here.
Okay.
One that actually popped up in my mind, and I'm not the smartest guy in the world, but how do members use your services? Or do you have, tools or templates to communicate, the strategies that they have to?
Yeah. So thanks for that question. And certainly we do have a lot of tools and templates. I alluded to a lot of them within the presentation this afternoon. So between those Excel sheets and the reference architectures, all of our material, if you've ever experienced our site, is downloadable. So we have either if it's an Excel or a PowerPoint or Word, a lot of different tools and templates you can take away and do yourself. So part of your subscription could be to do it yourself. There's another part where we do calls, so analyst calls with our members to walk them through the different phases and steps of the research that we've developed. And then we also have workshop teams, so teams that will either come out to your organization and meet with you and accelerate like your IT strategy or your digital strategy or some of your privacy and security concerns. And so they will do it through either a 3 to 5 day kind of engagement with you to develop out a plan. So it's sort of like a short-term consulting engagement. And then obviously we do have consulting as well on offer. So where we do sort of an end-to-end program implementation for you. So there's a variety of ways you can interact with us if you choose to become a member.
Fantastic. Well, we do have a couple questions here. John Jeffries asks, regarding projects that require IT services, it's for his hospital, they review the product or solution before a contract is signed. Do you have recommendations about security reviews to expedite the process?
Yeah, so our security and privacy team, I'll just step back to that slide. This is, again, very sort of 30,000 foot view of what our privacy and security team will do, but they'd have different sort of recommendations or advice that they could offer you either on an analyst call or after looking at the materials that you've developed. And so I wouldn't want to speak necessarily for them and their methodology in terms of specifically to your question, but I do think that engaging with them and kind of getting a second opinion on what makes sense from reviewing and signing on from a security perspective might be a good option there.
Good. Yeah, I think the question was, do you have recommendations? Sounds like you do. Sylvia Jessen asked, and I think this is a hot button for her because she asked about HITRUST yesterday as well.
Okay.
Do you have data regarding the adoption of HITRUST by healthcare systems across your customer base?
So we're not able to formally say that we have like HITRUST certifiers or reviewers of the HITRUST framework. But what I can say is that if I just flip back, and I'll just go back through the presentation so you get to experience all over again. In our management and governance diagnostics, so this colorful periodic table, we do advise our membership on those sort of 19 domains that HITRUST evaluates and certifies on. And so if you get a report back from a HITRUST evaluator and you're low in sort of like an infrastructure area or in a privacy and security area, what we can do is help you improve those processes, but we can't do it as an official HITRUST certifier. So what we would do is we would help you match up your domain that you're maybe concerned about as a result of going through HITRUST and put you on an improvement plan to get those processes evaluated and up to speed for a HITRUST certification.
Fantastic.
Mm-hmm.
One other question here. Actually, Sylvia's just responding. How about a HITRUST certified cloud provider like AWS?
So again, like we wouldn't say, like we could look at how you're interacting with AWS from an infrastructure perspective, but we can't say that you will pass HITRUST as a result of it because we're not certified to make that recommendation. Mm-hmm. We'll help you improve your process, but we can't say like, yes, you're good to go for HITRUST, everything's in order, if that makes sense.
Okay.
Yeah.
One other question here, and this is probably, putting your crystal ball on the table. John Jeffries asked, we currently use Amwell for telehealth visits with great success. Where do you see the industry going in the future with technology and everyday tools most have, such as cell phones, watches, and other devices?
Yeah, I mean, that's just such a great question because there's just been that exponential growth in virtual care and people have really adopted it quite dramatically. What I'm seeing in terms of what I'm reading on this topic and what I've heard about is that it'll plateau. And I think we are sort of in that plateau phase where most people, if they have a desire to connect, are connected. Now it's sort of like, how do providers refine their workflows? How do they iterate upon what they've developed? And how do they maybe even expand it out to other areas to offer care? So there's been a lot of investment over the years in the mHealth, like mobile health, integrating your iWatch into your EMR. It's not that simplified yet. There's not, in general, that level of integration, but I would suspect that there's a great interest. And so there's a lot of investment in enabling more personal health, more virtual health. It'll just depend again on whether it will be reimbursed from an insurance perspective, either through CMS or your private insurance, or whether it will also be scalable and sustainable with, ingesting all of that data into an already jam-packed sort of health infrastructure. So figuring out from a data perspective, the right tolerance for communicating that information and making sure that it will be sustainable long-term. But I would suspect there's going to be more great innovation in the mHealth virtual health space moving forward.
Fantastic. This was Jennifer. Thank you so much for your time. This was great.
Yeah.
We're seeing, comments. Great presentation.